everyone. I'm your host, Jennifer Jones. Welcome to Medical Mondays with Dr. O. There's a familiar saying that our eyes are the windows to our souls. Today's topic is awareness, understanding how our eyes are the windows to our health, with special guest, Dr. Renee Bovelle. It is my pleasure and honor to have each of you join us tonight. Thank you for being here with Dr. Opithami, MD, American Academy of HIV Medicine, for an exciting conversation about our health. Medical Mondays introduces health information, medical facts, and possible solutions as we examine health challenges that enables each one of us to live our best life. Whether providing high-quality medical care for families and individuals through Genesaret Medical Center, providing care for vulnerable communities through Global Vision Health Center, or providing medical missions in the U.S. or abroad, Dr. Opithami is committed to changing lives through healthcare wherever she goes, one person, one family, and one community at a time. Welcome to this opportunity to explore healthcare with one of our nation's leading community health advocates and world-renowned medical missions expert. Welcome to Medical Mondays with Dr. O. Dr. O, welcome.
Thank you. And welcome everybody. Welcome to another amazing segment of our routine health maintenance. Be prepared for an amazing time with Dr. Renee Bovelle, amazing ophthalmologist who is also my personal ophthalmologist. So I'm going to give this back to our host, Dr. Jones.
Thank you so much, Dr. O. You've already heard our topic for the day, awareness to understand how our eyes are the windows to our health. As Dr. O just introduced, Dr. Renee Bovelle is a profound board-certified ophthalmologist. She has offices in Bowie, Maryland, and is an esteemed leader when it comes to ophthalmology and all things health. This woman is not only an amazing physician, but she is also a wonderful philanthropist, an amazing speaker, and a community leader. She gives her time, her talent, and her treasure to the wellness of people. And that's why she's here with Dr. O today. So guests, throughout our presentation, if you have any questions as you listen to Dr. O and our Medical Mondays guest, Dr. Bovelle, please drop your questions in the chat box or raise your hand and you will be recognized after the medical presentation. Now, it is my honor and my pleasure to introduce Dr. O and Dr. Renee Bovelle.
Thank you again. So, the eyes. The eyes is the window to our health. Without your eyes, you cannot achieve your best potential. Without your eyes, without your sight, you cannot function the best you want. And sometimes you don't even know that you have problems with your eyes unless you get it checked. That is why it is part of routine health maintenance. Sometimes you have disease entities in your eyes that just because you can still see, you think all is well. All is not well. And so we're going to hear from Dr. Renee Bovelle as to what we need to do to maintain excellent eyesight. I, for one, used to go to Walmart to go get reading glasses when I found out that things were become too tiny for me to see. See, even as a physician, I didn't think the first step was to go to see an ophthalmologist. No, I went to Walmart and I said, you know, those reading glasses, they can make things bigger for me. She told me one day, she found out I was using reading glasses and said, get to my office as soon as you can. And if I remember correctly, she probably made the appointment for me because I would not have gotten there. So, Dr. Renee Bovelle, please educate us on how to maintain excellent eyesight. Thank you.
I'd like to thank you, Dr. O and Dr. Jennifer Jones, for that lovely introduction. I have a lot to tell people about eyes. It is a passion. It is my passion. I formed Envision Eye and Laser Center because I wanted people to be able to envision their best vision of themselves. And so with that, I'd like to get started. I have a PowerPoint presentation I'd like to go through, so then we can get started with questions. Can I share my screen now?
Absolutely. Dr. O, can you please ensure that Dr. Bovelle is a co-host? You are. You can share your screen now.
Okay, good. Okay. So, as we said, your eyes are the windows to your health. Most people, as we continue to progress in life, you should know you have good vision. You should have good vision and be able to maintain it. One thing that I want people to know is don't expect that as you're on the planet longer that you automatically have poor vision. No, that should not happen. Some of the normal things that you can see with aging include, as Dr. O said, the need for reading glasses, changing of eyeglasses. Sometimes eyes can become more irritated, and sometimes the eyelids and the tissue around the eyelids can change. It's important for us to understand the anatomy of the eye. The cornea here, this is the side view, this is the front view, is like the window, the covering of the eye. People who wear contact lenses touch their cornea, and that's normal. The white part of the eye here, and also seen here, is called the sclera, and it is covered by the conjunctiva, which is a translucent film, and it has blood vessels in it. Sometimes if you rub your eye too hard or something happens, you may get some redness, and that's due to the conjunctiva. Behind the cornea is an area that's filled with water. That's called the anterior chamber. And behind that is the iris. This is it in the side view, and this is when you look straight on. And the iris is what makes the eye brown, green, or blue. The iris has a hole in the center of it. That's normal. That is called the pupil. The pupil appears black, and it's because the iris comes down here and comes up here, and there's a hole in it. That hole is so that light can come all the way through back to the macula. Behind the iris is the lens. That's what turns into a cataract. It also allows for focusing. If some of you have kindergartners, kindergartners can hold things way up close and read that close. I can't do that anymore. I have to hold things further and further and further away because I need reading glasses. And that's because my lens is not as pliable and flexible as it was when I was 6 years old. Over time, this lens becomes brownish or yellowish or sometimes even white, and it turns into a cataract, and then we can remove it and restore vision. This area here is called the vitreous. We'll talk about that a little bit later, but the vitreous is a jelly-like substance. When we're first born, it's the consistency of a raw egg white. And then this orange-brown area here is the retina. The retina is like the film in the camera. We want the retina to be maintained in a pristine fashion. It shouldn't have any scratches or anything on it, because just like the film in a camera, when the film gets scratchy and you used to take your pictures with the analog cameras, the picture wouldn't come out right. Well, that's the same thing with the retina. The retina has blood vessels, arteries and veins, and it also has nerves. Okay, nerve, which is here, is what transmits the electrical impulses from the eyeball to the brain. If you think of your eye like a television set, and then you have a cable, it's like you have your cable at home, and that cable, these electrical impulses. Now, let's go over a few conditions. You may notice sometimes a white ring around the cornea. That's called arcus. It's a deposit of cholesterol. Generally, it does not cause harm to the vision, but it can be a sign that you need to go see your primary care doctor, like Dr. O, so she can determine if you have high cholesterol. This is a picture of corneal arcus. The arcus is this white area around the cornea. It's a whitish ring formed of a deposit of cholesterol. This does not mean you're going to have problems with your vision. Rather, it's a sign of increased cholesterol, and it means that you should go see your primary care doctor, like Dr. O, because the primary care doctor, like Dr. O, may want to investigate do a cholesterol panel or a lipid panel, see if you have high cholesterol, especially if you see this in people who are ages 45 to 50 and younger. So I'd like to say the eyes are the windows to your health because they let you know what's going on in the rest of the body. Dry eye, especially during this time of the year, with all of us being on Zoom, allergies can be another cause of irritation to the eye. And dry eye is increased as in age. Postmenopausal women, certain medications such as blood pressure medications, allergy medicines, antidepressants, and sometimes taking certain eye drops. Also, there's certain diseases that can be associated with Sjogren's. And I'm sure Dr. O can name much more than these, like Sjogren's syndrome, rheumatoid arthritis, lupus, and systemic sclerosis. Now, I said that blood pressure regulators may cause dry eye or may be implicated in dry eye, but that does not mean that you should not take the blood pressure medicine that Dr. O may have you on. No, what it means is Dr. O and I need to work together so that I can figure out what kind of drops I can use to treat the dry eye. And sometimes people may say, on occasion, they may need to use artificial tears or lubricating drops that they get over the counter. Those can be okay as a temporizing measure, just to fix the eye temporarily. But you should come to your ophthalmologist because tears aren't just formed of just water. They're a complex mix of proteins and electrolytes, and the tears have all kinds of proteins in them, which help to keep your eye comfortable. This is rosacea. This is another cause of ocular irritation. Your eyes may get red, they may be irritated. You see how red the eye is here. The eyelashes may not, the eyelash space may not look comfortable. And sometimes we have to treat this with antibiotics or with mild steroid creams. In addition, you may see something called a pterygium. Pterygium means winged shaped growth. And you can see how this sort of looks like a triangle, like a wing. And this occurs in people who are outside in the sun a lot in tropical areas. Sometimes it's called surfer's eye because surfers tend to get this a lot. And this growth can grow over the cornea. And this is the pupil here, this dark area. And if it grows too far over the pupil, then it can interfere with vision. But thank goodness we're able to treat this by removing it surgically. Now, I'll tell you one thing that's good to help with this is to wear sunglasses. That can help prevent it. And this is a pingueculum. The pingueculum is sort of like a small pterygium. And this has not started to grow into the visual axis yet, but you can see this needs to be watched. And certainly people with this kind of growth need to come to the ophthalmologist because it could be something else as well. As I said, rheumatoid arthritis has a lot of ocular manifestations. And Dr. O will let you know, rheumatoid arthritis is different from osteoarthritis, which is problems with the bones kind of grinding together. Rheumatoid arthritis is an autoimmune disease. And sometimes we can get red eyes, but it's from a different cause. So you could see there's mostly red here and here. Sometimes it can be red with a little white space intervening. And if you have something like this, please go see your ophthalmologist who's either an MD or a DO, a doctor of medicine or doctor of osteopathy. People with thyroid problems can have eyes problems. You may remember the First Lady Barbara Bush, and remember her eyes were very wide open. And that was a sign of thyroid disease. We now have ways to treat that. So you don't have to have that appearance, and that can cause dryness and irritation. When somebody opens their eyes and you can see there's a white part above, that can be a sign of thyroid disease. If you look at your friend's eyes or your eyes, you can see generally the eyelid comes to about here. So this is called scleral show. When we see that, please go see your ophthalmologist. Let's talk about glaucoma. Glaucoma is very prevalent in Africans and African Americans. Some of the risk factors include increasing age, African ancestry, Asian ancestry, nearsightedness, and family history. Let's go into that. Remember, we talked about the optic nerve. The optic nerve connects the eyeball to the brain. And you can see this little light area here in the normal optic nerve. But in glaucoma, that area widens. We call that cupping of the optic nerve or of the optic disc. This means part of the optic nerve has sort of been eaten away. It's due to pressure. How do we test for it? Well, I use a machine similar like this called a visual field test. And we test your visual field because we want to check your vision from the periphery, because the glaucoma steals your vision from the side and you're not aware of it until it's very late in the game. This is what a normal visual field looks like. And all of this dark area is loss of visual field due to glaucoma. Now, let's talk a little bit about retinal problems. Retinal disorders account for about 1/3 of all legal blindness here in the United States. They include macular degeneration, diabetic retinopathy, and blood vessel blockage related to high blood pressure. Diabetes leads to vision loss because patients get earlier cataracts, but that's okay. We can remove cataracts. They also have increased glaucoma and increase in retinal disease. Diabetic retinopathy is a major cause of vision loss here in the United States. And I keep saying the United States because I know because of Dr. O and Dr. Jones's hard work, we have people here throughout the world. So I'm focused on the United States as far as major causes. We treat diabetic retinopathy with laser, regular eye exams, and sometimes injections into the eye. But the most important way to treat diabetic retinopathy is to work with your primary care doctor, like Dr. O, so she can help you to maintain a low blood sugar. Every diabetic patient I have, I always work with their primary care doctor, and Dr. O knows that. We work hand in hand. This is what not so bad diabetic retinopathy can look like. We call this non-proliferative. Now, what happens is the blood vessels leak blood, they leak lipid or fat. All these whitish areas are fat. And this is the macula. This is where you see your sharpest. And you can see in this person, they have lipid and leaking of blood, which we call hemorrhages. This is a picture of proliferative diabetic retinopathy. It may be hard to see, but there's like a fan shape of blood vessels there, fan-shaped new blood vessels. There's also a larger hemorrhage here, and that can cause blindness. That needs to be treated by laser. Now, in people who have high blood pressure, please do what Dr. O says and get your blood pressure down. It's important that you see your primary care doctor on a regular basis if you have high blood pressure. And I'm just going to interject something here, Dr. O. Please do not try to wean yourself off of the medicine if you go and see Dr. O and she says your blood pressure is good, because then if you wean yourself off, it's going to go high again. Isn't that correct, Dr. O?
That is 100% correct.
So let's talk about some of the problems with high blood pressure. You can get an occlusion in the vein, meaning it can be blocked. It's sort of like a stroke almost. And if the central retinal vein gets blocked, it looks like this, because the blood, it's sort of like when you have a hose and you squeeze the hose and it all gets backed up because you've squeezed the hose and the water can't come out the end of the hose. So then what happens? Eventually the hose starts to burst and the water leaks out through the side. Well, the same thing happens with the blood vessels. We call this blood and thunder because it looks very angry. The other thing that can happen is the arteries can get occluded. That means that the arteries provide nourishment to tissue. And that means that the retina is not getting the nutrients it needs from the arteries. So what happens? It dies. And when part of the retina dies, it turns white. There. So this person may experience a sudden loss of vision, not their entire vision, but part of their vision. And let me go back one. And if it's the central retinal artery, this whole thing will be white. And unfortunately, we have not progressed enough to be able to bring that vision back. So please, everyone, I'm asking you to see Dr. O or your primary care doctor to be careful of this if you have high blood pressure. The thing to do is to maintain your blood pressure. That's the most important thing. This is like a stroke. This is a stroke of the eye. Now, we talked about some serious things. We're gonna go back and talk about some less serious things that normally happen as a part of aging. You may remember in the beginning, I said that this area here is filled with vitreous. The vitreous is like a jelly, and when we're first born, it's like the consistency of a raw egg white. It's kind of sticky like that. And as time goes on, it becomes more watery, and you can see proteins, clumps of proteins floating around in it. Oftentimes people say, hey, I see a floater, or I thought I saw a gnat, and it's not really there. That's normal. Eventually it goes away and you don't notice. But if you notice sudden onset of flashes or a lot of floaters that look like black rain coming down, that's a sign to let your ophthalmologist know. That could be a sign of a retinal detachment. Or if you see a shade coming across your vision from any direction. Now, let's talk about one of the most common surgeries performed in the United States, cataract surgery. And it is very common, and it usually takes less than half an hour, often less than 15 minutes. So, when you start developing a cataract, you may notice that your vision looks sort of like you're looking through wax paper or frosted or foggy window. And like I said, it's a leading cause of reversible, this is the key, reversible blindness in the United States. And just routine things can become blurry, harder to see, harder to drive, harder to read. So with cataract surgery, we remove this lens, we make a little incision here in the cornea, we remove it, and we replace it with a clear synthetic lens. Now, you have options if you have to have cataract surgery. And the good thing nowadays is that initially we only had monofocal lenses. That means you could only have the vision set for one distance. But now we have multifocal lenses. And multifocal lenses allow us to see different visions, both near and far. So here with the monofocal, you can see out in the distance well, but your close vision and your intermediate vision was difficult. But now we can treat astigmatism with the lens, and you can see, and we use multifocal lenses, and you can see distance, intermediate, and near. Now, I know we talked about a lot of things, but I just wanted to whet your appetite and see what kind of questions you may have that I can answer. Dr. O, are there any questions, or Dr. Jones, that maybe you can let me know?
Thank you so much, Dr. Bovelle. We have enjoyed your presentation. So the first thing I'm going to ask you to do is to unshare your screen. And I think we're going to be dropping your address to your office in the chat box throughout. And before I begin our question and answer session, I'm going to pitch to Dr. O to share her feedback on your presentation, and then we'll begin with questions.
Thank you, Dr. Bovelle, and thank you so much, Dr. Jones. Diabetes is still the #1 cause of blindness in the world. And yes, I know you're focusing in the US, but I could not help myself. You're right, Dr. Jones, Dr. Ayoti, myself, we work internationally. So in the world today, diabetes is the #1 cause of blindness. I wanted to repeat that. So it is important to get blood sugars under control. If you have diabetes, it doesn't mean you would automatically get blind. Or if you have high blood pressure, it doesn't mean you would get blind. You will not actually if you control these disease entities. So it is important to make sure that you get your blood pressure checked, your blood sugar checked, cholesterol checked at your primary care doctors during your routine health maintenance, because these things, when properly taken care of, will prevent devastations. they will prevent eye problems and many other problems. So thank you so very much, for that wealth of information you gave us. And if I may, take the latitude to ask the first question. So, can you tell us what I was doing, going to Walmart, Walgreens, Giant, what have you, to buy these reading glasses? It's very easy. You test them and you see which one you can read better with. Doing that, how can that hurt the eyes? Because what I did then was not even investigate why I wasn't seeing close up anymore. I just assumed that it's aging, like you rightfully said. I know it's not the right thing to do, so I'd like you to address that, please.
Sure. If you don't mind, I'd like to share my screen again so I can
Absolutely.
show you. Okay. Okay. Okay, what I'd like to go over here is how the eye, like I said earlier, the light comes through the cornea, through the aqueous, through the pupil, through the lens, and it focuses right here in the macula. Right here, this is the sharpest vision. Now, some people may need glasses because the focal point, instead of focusing right here, it focuses behind the eye. We usually say that person is farsighted. Now, it can also focus in front of the eye. We usually say this person has a longer eye and that person is nearsighted. The eye sort of appears, like it's too long. So the light focuses in the middle. That person is nearsighted. They can see things up here pretty close. Then there are some people who have astigmatism. And with astigmatism, there may be more than one focal point because of the curvature of the eye. Now, what can happen in astigmatism, we say the eye doesn't have the same curvature all around. It has, it's not shaped like a baseball or a basketball. Instead, it's shaped more like a football. So you see, there's two curvatures. There's a more flat curvature, and then here, a more steeper curvature. So what happens in presbyopia, that is the need for reading glasses. What happens in presbyopia, the lens that we talked about, here is the lens, isn't pliable. So when we're young, like when we're kindergartners, when we want to see up close, the lens can go into a ball almost like that. But as time passes, instead of the lens being able to flex back and forth like that, it becomes kind of stiff and it likes to just stay in one position. It may be able to go like that, but it can't go all the way down. So because over time it hardens and becomes and stiffens, we're unable to focus up close. To focus up close, it needs to be like this, like a ball. But ours tends to stay like this. So when you get the reading glasses from Walmart, and they're okay in a pinch, they really are. But when you're doing a lot of reading and you're on the computer a lot, it's going to lead to eye strain. Why? Because that lens is not made specifically for your eye. And if you have astigmatism, it will not be sharp. It will be bigger, but it still won't be sharp. And that's going to lead to eye strain, make your eyes tired. That can lead to headaches and things like that. So because Dr. O, I know all of the hard work that you do, I wanted you to have the best possible vision. So I wanted to make sure you had a prescription that addressed your astigmatism and either myopia or hyperopia in addition to the presbyopia. So the glasses from Walmart only address presbyopia. They don't address 1, 2, 3 things.
Thank you.
Dr. Bovelle, that is absolutely awesome. Dr. O, do you have any more questions before we begin our litany and even my own?
Yes, I have another question.
Yes.
So, before I actually ask that question, it's not the right thing to assume that it's just, you just farsighted or you have presbyopia is why you can read, you can see well anymore. It's important to go to the ophthalmologist to see if there are other underlying issues, even more than astigmatism and all that Dr. Bovelle had mentioned. Sometimes it is Dr. Bovelle or other ophthalmologists that send patients to us because they see other things and they say, oh, this is the cause of this, and then, revert back. So it is important to get those eyes checked. So my next question is, I don't like these glasses. And I have so many of them that I throw around in the house that I can't find most of the time. You remember, I just bought a bunch. I buy a bunch when I come. So how about laser? What would you say about having, laser surgery? Is it a good thing to have? And what are the long-term effects of laser surgery if one has it, if there are any long-term effects?
Sure. That's an excellent question, Dr. O. A lot of people get tired of their eyeglasses. So depending on the health of your eye, depending on the health of your whole body, you may be a candidate for what we call laser refractive surgery. You may have heard it called PRK or LASIK. Generally, people who are of the age where they can have cataract surgery, I don't recommend that because they can have the cataract surgery and remove the cloudy lens or just the lens period, and we can put in a lens so they can see both distance, near, and intermediate vision. So for people in their 20s, 30s, 40s, LASIK is fine, or the laser vision is fine. But for people who may have a slight cataract, I usually recommend early cataract surgery. But you have to see an ophthalmologist first. Now, I'm going to put a caveat out there. You should go to see an ophthalmologist that does more than just laser vision surgery. And I'm not downplaying those corporate sites for laser, but what I'm saying is there's a saying, right? It says to someone who has a hammer, everything needs to be nailed. Everything's a nail, right? So if you go to your ophthalmologist, your comprehensive ophthalmologist, they can let you know if there's anything else going on, and they can talk to you about alternatives as well, because there are alternatives. The alternatives include, there's laser vision correction, there's something called SMILE, where we remodel, reshape the cornea, and there's something called refractive cataract surgery, which allows you to see distance vision, near vision, and intermediate vision.
That is absolutely wonderful. So I'm in the 50+ club, Dr. Bovelle. I think my eyes are healthy because I do get them checked annually, and I owe you a visit to come and get me ready, because I'm like Dr. O. I'm tired of the glasses. I don't want reading glasses, contacts. I had the 30-day contacts, but because of COVID, I went to daily contacts. They don't have the bifocal in them. So I have all kinds of complaints and I know you can solve them.
Well, you bring up a good point. I'm very glad that you went to the daily contacts during this COVID time. That is excellent. The daily contacts are healthier. They keep your eye healthier, less germs. So you did the right thing.
That's excellent. So we have a number of people in the chat box. So we're going to continue questions for just a moment more so that we can move forward and close the official show and then proceed with our after hours Medical Mondays. So I want to ask a question because I've been wearing glasses since I was in puberty. And so I have a question. When we were growing up, they always told us, eat your carrots, they're good for your eyes. So since we have you today, can you just talk to us about eye health and nutrition? Are there foods that we should be eating, that younger people should be eating, that mature adults should be eating for our eye health? Or are there foods that we should avoid for our eye health?
Sure. Well, let me let you know, Dr. Jones, your grandmother was right. Eating carrots is good for your eyes. And I know that Dr. O tells her patients to eat the rainbow, and she is correct. Carrots have lutein, which is good for the retina. Eating a wide variety of fruits and vegetables provides nutrients. Vitamins A, C, and E are all excellent for your eyes. The other thing I'd like to let people know, I know we have a lot of parents here, and for children who are, I think it might be 10 and younger, they should get 2 hours of sunlight each day. That doesn't mean they have to stare at the sun. No, they just need to be outside, exposed to the sun for about 2 hours. Why? And this is cutting edge research. I was just at a conference, a Zoom conference, and this is cutting edge research. Sunlight helps to prevent myopia, which is also called nearsightedness. It's not just not looking at the computer, it's actually the sunlight. So if you have kids, they should be outside. I know it's COVID, but take them for a walk or let them run around outside in your backyard if possible, or even sitting out on the patio or on the front porch for about 2 hours. Maybe they can do some reading sitting outside, but that helps to prevent myopia.
Thank you, Dr. Bovelle. One of our participants asked, in cases of cataracts, when is it right to be removed and replaced?
Excellent question. Just because you have a cataract doesn't mean that it has to be removed. There are stages. Usually we grade them stages 1 to 4, with 4 being the worst. So you may have just a slight cataract. It doesn't bother you. You don't notice it. It doesn't interfere with your daily activities. So the time to remove the cataract is when it interferes in your daily activities, or if it's causing trouble for me to see inside your eye to monitor your eyes, such as problems for glaucoma, diabetes, things like that. Now, I had patients who had a small cataract. We all know that we say the best vision is 20/20. I've had a patient with, let's say, very small 20/25, 20/30 cataract, but it was right in the center of his vision. And he was a shooter, and he would try to look through the scope and he couldn't see because that cataract was right in the center. So that interfered with his activities of daily life. So he had to have it removed. We removed it and he did very well. Now, I'll have some patients who have their cataract is 2100, which means they're not seeing well at all. They can't even pass the driver's license test. But for whatever reason, it doesn't bother them. They're happy like that. I'll still encourage those people to remove the cataract so that we can monitor their eyes for diseases. Because if I can't see in, the patient can't see out.
Wonderful.
So it's a conversation that you have to have with each patient.
Wonderful, Dr. Bovelle. So we thank you for such an amazing show today. And we are just excited to be able to have you in our Medical Mondays after hours so that we can continue this conversation and continue to have the questions answered that we need.
What an amazing information we have had. The eye is very important. Take-home message is part of routine health maintenance. See your eye doctor. See your primary care doctor. Do routine checks because sometimes you may think all is well and all is not all that well. When we diagnose early, we do fantastic. When we wait, sometimes it's too late. So the earlier, the better to catch whatever may be wrong so that it can be fixed. Let's keep our eyes healthy so we can achieve our fullest. Thank you.
Thank you so much, Dr. O. I am so excited that I just got a word from Dr. Caprice that we have a Medical Mondays winner for today. The Medical Mondays VIP and champions are individuals that bring to Medical Mondays up to between 10 and 25 guests. That makes you a Medical Mondays VIP, or more than 25 guests, and that makes you a Medical Mondays champion. And I am so happy, pleased, and honored that continuing their strong record of support for Medical Mondays, Hannah and AJ are our champions for Medical Mondays today. Hannah and AJ, can you please unmute your mics so that we can just have everyone see you? We want to see your camera, and thank you so much for just being the most supportive, loyal, amazing champions that we could have on Medical Mondays. They started a dynasty, Dr. Bovelle, at the beginning of the show. They were winning every week, and Dr. Ajagwe came in with the fierce number and became our first Medical Mondays champion. And so we have Medical Mondays champions and VIPs, and we give them prizes every single week. And so this week, for our Medical Mondays prize, we are going to give Dr. Hannah and AJ a gift certificate to the King Street Oyster Bar. The King Street Oyster Bar is a wonderful restaurant in Washington, D.C. at 22M Northeast. And we're gonna make this a beautiful and special day that we're gonna either do brunch on the weekend or lunch on the weekend or dinner, whichever one you desire. But that is your gifts for this week's VIP championship for Medical Mondays. Thank you so much. Any comments, Dr. O?
Oh no, I just want to come.
You absolutely will be there. We are going to make it a beautiful date. So I have your contact information, but Hannah, please reach out to Dr. Caprice to make sure that we all coordinate your King Street Oyster Bar reception with Medical Mondays.
Congratulations. Thank you.
Appreciate it.
Congratulations. And I'd like to give a shout out to AJ because he has helped me with some of the electrical systems in my office. So because of him, I'm able to continue to see patients.
Yes. And AJ does that for
awesome.
That's
He
awesome.
does that for all of us. He's there like this at the heartbeat when we need him. Thank you.
Thank you.
Thank you.
I like your presentation. See you.
Thank you so much, Hannah and AJ. And now, you know that before we conclude today's Medical Monday, we always love to hear from our audience. So we have been, as all of you know, for the last several weeks, preparing for what's about to happen On Monday, May 17th, we will begin the new phase of production. Now, that doesn't mean that all of the great knowledge that we've had from giants like Dr. Renee Bovelle today, giving us a powerful presentation about eye health, but what it does mean is that we are going to now be able to take all of the shows that we've had today and have them edited and added to our YouTube channel. So there's going to be a lot of activity going on and you'll hear more. But as we continue to expand the show, we will integrate fitness, nutrition, continue to have expert guests like Dr. Renee Bovelle, and continue our mission to educate, inspire, and empower you. We want you all to email us and remember our mantra: strong health, strong future. We look forward to our next conversation on Monday, May 17th at 7:00 p.m. Now we are going to continue with our question and answer session. Dr. Bovelle, Dr. Ophisami, we know that we have had all kinds of adventures going on tonight. We've had an unorthodox, untraditional show. Nevertheless, we have great content, and our video productions team will just have to work it out, because we have to continue this mission to educate, inspire, and empower people about their health, because your health is your wealth. Strong health, strong future. So let's get back at it. There was another question about laser surgery, and then we'll go back to the lineup of questions. If anyone has questions from here on, please just raise your hand and we'll acknowledge you and allow you to move forward. For the laser surgery, is it a permanent solution for the correction of sight, or might you have to keep going back for more surgeries? And if so, how often?
That's an excellent, excellent question. So as we talked about with presbyopia, the reason with that doesn't correct, laser vision doesn't correct presbyopia, because the laser shapes the front part of the eye, the cornea, but the back part of the eye, the lens, or the middle part of the eye, the lens, still continues to stiffen. So if you had laser surgery when you're, say, 30, by the time you're 55, you're going to need reading glasses. Now, sometimes we can reshape the eye a little bit, but there's only so much reshaping that we can do. So maybe you can go back once, but you shouldn't keep going back, continuing and continuing, because otherwise there won't be enough cornea left.
Absolutely, excellent. Another participant asked, if you have cataracts, does it affect your peripheral vision?
Excellent question. Cataracts generally affect your center vision, because the whole part of the cataract tends to get either brownish or yellowish or whitish. And so it's the center vision that's generally more bothersome. If you have problems with your peripheral vision, you should still go see your ophthalmologist, because it could be due to something else, like glaucoma.
Thank you. What causes high pressure in the eyes? And I want to comment that this participant wanted to say, thank you, Dr. Renee. I've learned so much from your presentation. What causes high pressure in the eyes?
Well, thank you for that. That's an excellent question. Glaucoma is not like high blood pressure, where with high blood pressure, Dr. O tells us not to eat too much salt. She may tell us to exercise, things like that. It's not the same way with glaucoma. Glaucoma can occur if you have diabetes and there's a drainage system around the eye, and the blood and the fluid that we talked about in the anterior chamber can't get out. If you don't mind, I'm going to share my screen again. Okay, so you can see my screen. So this area here, which is the connection between the eye, the cornea, and the iris, is where fluid tends to drain out, and it comes out and goes out through the conjunctiva and out through the back to the back of the eye. this area here can get clogged with new blood vessels in people who have diabetes. So if this area gets clogged, or if the angle, you see this angle here, tends to be narrow. Some people have a narrow angle. We could call that narrow angle glaucoma, or if it's due to blood vessels, it's called neovascular. Neo meaning new, vascular meaning blood vessels, new blood vessel glaucoma. Those are less common. The most common, which we call primary open angle glaucoma, we don't really know what the problem is. Sometimes the drainage system can just get kind of sick. Sometimes you can overproduce fluid. And it also may be because the collagen, the collagen that makes up your cornea and your optic nerve may be more susceptible to fluid changes, fluctuating fluid changes. So in many cases, we don't know why people have glaucoma. We're studying that, but we haven't, and there may be more than one cause, but we're working on that. So we kind of know how to treat it, and we have different ways to treat it, but we don't know the exact cause.
Wonderful. Our next question is, what type of glasses are recommended for persons who look at computer screens 6 or more hours a day?
Yes, and that's many of us now, right? So you can use, they call them the blue blockers that block out that irritating blue light, or what might be even easier is you just buy a screen to put over your computer so that that light doesn't bother you as much. You can also put your screen on night mode so that it doesn't bother you as much as well.
So the blue blockers we can find in the convenience store, office store, or order online through Amazon.
Yes, but if you have a prescription, then when you get your glasses, you can ask the optician to put that in your glasses.
Oh,
So
wonderful.
that way
Thank
you
you.
don't have to change.
And for the screens, should we also go to our physician to ask us about the screens too?
You know, I have had to write prescriptions for some of my patients that they can have a screen placed on their computer at work. And sometimes that's an accommodation that needs to be made. So I do that often. And then you can, for your screen at home, you could just buy a anti-glare screen from your computer store.
Wonderful. Our next question, there's a comment preceding the question. Good job and thanks for a very elaborate presentation. I see some aged folks, say 90 plus years, with no eye vision issues at all. What could help us have and keep our good eye vision?
Okay, well, I think Dr. Jones asked about the carrots. Some of it's genetics, and there's another talk I give on eye and nutrition, but some of it's genetics, and with our whole body, Dr. O will tell you, we have our genetics that we have to deal with, but we also have our environment. And our environment can play a great role in the health of our whole body, not just our eyes. So eating the carrots that your grandma said, eating the rainbow, like Dr. O said, and wearing sunglasses and making sure you have proper nutrition, vitamins A, C, and E. Those are the antioxidants that can help.
Wonderful. We have another question. Is there a side effect to using Visine eye drops daily to take the red out of someone's eyes?
Yes, there is. You become dependent on it. And what happens is you always have to put the Visine in. And then when you don't put the Visine in, your eyes get even more red. So you want to find out the cause for the redness. We like to treat the cause if possible, not just the symptoms. So your eyes could be red because of dryness, because of allergies, because of you may have an autoimmune problem, you may have a condition that's making your eyes red. So we like to figure out what is going on that makes your eyes red, and then we can help get rid of that symptom, and that can brighten your eyes.
Thank you. Someone else asked, can you please address the issues of blocked tear ducts?
Oh, sure. Blocked tear ducts can occur and commonly occur in babies, okay, children. Because when we're first born, our tear ducts may not be all the way open or patent. So sometimes we have to do a small procedure in babies where we have the mom massage around this area, or we have to do a procedure to unblock that blockage. It's usually a little bit of skin and we just poke right through it and the child is fine. Now, it can also happen in adults. When it happens in adults, again, we want to know why and what happened. Sometimes it could be because you've developed an infection and it gets clogged through the infection. So we have to give you antibiotics and do different things. Sometimes it could be because of trauma. If it's because of trauma, then of course that has to be fixed surgically.
Dr. Bovelle, I have another question. We talked about contacts and how I switched from a monthly to daily for eye. Is there anything that happened to eyes during the COVID-19 pandemic? There's so many symptoms that were related to, from breathing and respiratory issues to heart and neurological issues. What about the eyes in COVID-19?
Okay, yes, we saw a lot of problems with eyes during COVID. First of all, wearing the eyes are part of your body. They allow entrance for germs, right? So people who wore glasses, even though we're all trying to get rid of our glasses, were more likely to be protected because it's just like wearing a mask. So those of you who wear glasses, I'd say keep wearing them for a little while. The other thing that we have seen is because we're wearing the mask and the air, when I'm talking, comes out this way, now the air has to come up this way. And it's like I'm blowing on my eyes constantly, like a wind tunnel, like this all the time. So that leads to dry eyes, or what we call dysfunctional tear syndrome. So my eyes aren't as lubricated as they normally are. They may burn, they may itch, I may find I'm blinking a lot, they may get red. So we've seen an increase in dry eyes. We've also seen an increase in styes or chalazions, the bumps that you get on the eye. We've seen an increase in that. Again, because the eyes constantly have a wind tunnel, and there are glands around your eyelashes called the meibomian glands. They produce an oil. If it gets too dry, those glands can dry up and the openings at the end of the glands get clogged. And then that oil backs up and creates a bump that we call a stye. The other thing that we saw is that you may know that COVID caused inflammation throughout the entire body. Lots and lots of inflammation. And that inflammation can cause blockages in blood vessels. So we've seen people with those vascular occlusions in the veins and in the arteries. We've seen an increase of that during COVID.
Thank you so much. So as a follow-up, do you recommend us investing in and continuing to use the glass shields? Like the CDC is saying reduce masks. Well, most of us are going to continue to wear our masks until the death rates are really down and the disease is really down. But do you recommend us using the clear shields, whether they're over the head or from the neck up, rather than mask to reduce some of the impact?
If you're outside, I don't think you need to do that. I personally don't do that anymore. I did it early on, but I, thank goodness, have been vaccinated. And I would strongly suggest everyone hearing this, whether it's live or later on, please get vaccinated. Please, I'm asking you, please. It's for your health. So if you're vaccinated, I think that you probably don't have to wear that. Now, if you're going, I know some people are starting concerts and things like that. I'm not going to those large outdoor gatherings, but if I were, I would. If I'm in the airport, I haven't flown anywhere yet, but if I were on the airport, certainly I would wear it, because there's so many people around and you don't know what they're doing and what they're exposed to.
Thank you. That's excellent. Another participant asked, why is it that every time I visit an ophthalmologist, my glasses prescription always go up?
You mean gets worse?
I think that's what they mean.
Okay, probably what's getting worse is the presbyopia, because again, the lens, remember, it can flex from here to here when we're kids, but as we spend more time on the planet, let's put it that way, instead it can't go all the way down here, maybe it can go to here. The next year, maybe it can only go to here. And then the next year, maybe it doesn't move much at all. So that's the reason why.
Wonderful. The next question, someone said that we need to have another session with you, Dr. Bovelle, on eye and nutrition, just to teach us more.
Okay.
Please address the issue of hypertelorism.
Yes. So that's happens from birth. So the patient's eyes may be further apart than normal. That is a problem that may be addressed with surgery. Usually, for the most part, people who have that may have other issues sometimes, but that is more of a surgical issue. Sometimes it may be that we can use prisms to help, or it may be that just some people's eyes are a little wider apart, but they do just fine. And you have to be careful, because some people may say that, but really that's just who you are. You know, that you have to be careful of using certain terms like that, because it may be that's just how wide your eyes are. My eyes may seem to be a little wide apart, but that's just how I was made. So it's not necessarily a certain length, there's a range.
Wonderful. Someone asked, will excessive crying destroy one's eyesight?
No, it doesn't. And people have often told me, if they've seen me after a funeral, that their eyes are red. Well, yes, your eyes are going to be red after you cry, but it doesn't really affect your eyesight. It's just sad that you're crying a lot, but it won't hurt your eyes for the future. No. And I'd like to say that your eyes, your tear ducts are connected to your nose. So that's why when you cry, you get a running nose, because the tears drain down through your tear ducts right here into your nose.
So we have a couple of other questions on Dr. Bovelle that are now everyone's seem to be stimulated. What causes crossed eyes? When individuals are crossed-eyed, what causes it?
Okay, well, this is your eyeball, and there are muscles. 1, 2, 3, 4, 5, and 6 muscles. And so let's say I have a muscle here, and it pulls my eye up. I have a muscle that pulls my eye down, one that pulls it to the left, one that pulls it to the right. So, and one that turns it this way and one that turns it that way. So these muscles have nerves attached to them. Now, when we're born, sometimes you can just be born like that, born with the, hopefully you can see, there we are, with the eyes turning this way or like this or like that. That's called strabismus. And what we have to do is we can correct that either with surgery or with patching or with eye drops. That's a congenital, that means with birth. That's a with birth condition. And there are doctors, ophthalmologists that specialize in that. So after they do 3 years of ophthalmology training, they do an extra 1 to 2 years in strabismus. Now, it can also occur in adults. We call that acquired strabismus. Strabismus just simply means that the eyes don't work in tandem like that. One may go like that, one may go like that, one like that. So in older people or in anybody who's acquired, it can happen due to trauma. So if for some reason you get hit in the eye and you get a fracture, that can cause the muscle to become entrapped or swollen. It can occur due to thyroid problems. Remember we talked about Barbara Bush. Well, another thing that can happen is those muscles become swollen and they don't work as well. So one may not work as well, one may work this way or that way. So thyroid problems are another reason. Another reason, as Dr. O knows, is that it can be due to blood pressure and diabetes. That's why she's smiling, because she knows I'm going to call on her to help control that. I recently had a patient who came in during COVID and one eye was turned out. Why? Because the blood pressure got out of control because the patient was eating a lot of salt, because we've all been sitting at home and watching TV, watching Zoom, and the patient was eating a lot of popcorn, which is salty, and that caused the blood pressure to go up. And then that resulted in that nerve getting weak because of the high blood pressure. So I'm going to ask Dr. O, or you to please see Dr. O, because she's going to monitor that. A lot of the systemic problems we see in the eye are due to problems that Dr. O can fix or maintain or treat.
Wonderful. Dr. Bovelle, we have 3 more questions before we begin to conclude today's program. One, I'm going to ask this question, maybe the 3 things, and then you can address them one after the other. One participant asked, what causes watery eyes? And another asked that you address the issue of twitchy eyelids and nystagmus.
Nystagmus. Okay, so I see these in the chat. So
what causes
watery eyes and twitching eyelids? Generally, those can be related. Those generally are due to dysfunctional tear syndrome. Now you may say, watery eyes, why do you call that dry eyes? You're right, it's really caused dysfunctional tear syndrome. So the tears, as I mentioned before, aren't just water or aren't just saline, okay? They're made of 3 components. There's the first layer is a mucus layer. And you know, mucus is very slippery, like okra. It's very slippery and it keeps things from rubbing together and being uncomfortable. Then you have a water layer called aqueous layer. And then you have an oil layer. The oil layer is produced by those meibomian glands, those oil glands around your eyelashes. Well, what does oil do? Just like we put oil on our skin right after we take a bath, because it keeps our skin from drying out, right? Well, the oil keeps our eyes from drying out. So we have those three components. Now, if for some reason, many different reasons, one of those components may not being produced in the right amount, the whole tear complex is going to start making more, because we're not able to just say, oh, I'm not making enough oil. Let me tell my body just to make more oil. Or I'm not making enough mucus. Let me tell my body just to make more mucus. No, the body's going to say, hey, I don't have enough oil. I'm going to start producing more and more and more. And then you get an overproduction of the other ones. So then you tear up a little bit. So that's why you get watery eyes. And then the twitching eyelids is related to that, because as your eyes get dried out and irritated, you're going to blink more, and then your eye kind of starts doing it automatically because those nerves are overstimulated, they're not healthy, and it can cause a twitch. Now, the other reason why you can get a twitch is drinking a lot of caffeine, soda, coffee, things like that. Those are generally the two most common. And then sometimes stress can do it as well. Now, those are the most common reasons. Now, if it continues to happen and you start noticing that it's your whole eye, like you're twitching like that, if you can see, or you get a tick like that, you have to go see your ophthalmologist and Dr. O. The reason why is you want to make sure that nothing else is going on, that you don't have a problem with the nerves going further back. Oh, Miss Ogbonna, yes.
I'm muted.
Yes, absolutely
He
wonderful.
has a question.
I don't have a question. I have a comment. I'm looking at you, seeing your eyes because of you. I came to you, I could say that I was blind because the eye doctor that I was seeing, a sister came to me and said, oh, I heard that you go to that doctor. You better run. You're gonna go blind. So that gave me a concern. I went to my doctor, Dr. O, of course. Who else? I said to her one day, casually, she know me very well, that I don't complain, I don't say nothing. We were talking when I went for checkup. I mentioned, they said I have the glaucoma. She said, oh my God, I have a doctor for you to go see now. She wrote that prescription for me to come to you. I can tell you that because of you and Dr. O that sent me to you, I can see your eyes with glasses. When I came to you with the glasses they gave me over there, I couldn't see people's eye when they are talking like computer. Reading was a problem, everything. But since I came to you, even now I can drive a little bit in the night. Before I came to you, I couldn't drive in the night. You are a good doctor, but the only thing is people spend hours there. If you can help with that, that would be, you are a very, you care about people's eye. And I thank you so much for what you have done for me, for my eye, because if I go blind, it will be very devastating for my family. I thank you, Dr. Bovelle. Thank you so much. Thank you, Dr. O, for taking me to her, because what she has done with these two eyes, you can't believe it. And that's why I can testify that she is a very good eye doctor. That's what we call you. I don't know the other word. Good eye doctor. I appreciate you. Thank you so much.
Thank you so much, Miss Edna. Wow, what an absolutely beautiful testimony. Thank you so much.
Well, I appreciate that. And it is my pleasure to be able to serve you. Yes, people do wait sometimes, but I am so invested in each and every patient. I want to do my best and give them the full time that they need so I can figure out what I can do to help them. Because some of the patients who other people say, it's too hard, I'm going to leave it alone, nothing else to do. I don't want to take no for an answer. I want to figure it out. So it takes a little time sometimes, but I'm glad you're sticking with me. I appreciate that.
Thank you.
I think it's absolutely wonderful, Dr. Bovelle, that you are providing quality health care, and Dr. O is the same way. And you know, someone put it in the chat, and it's what I was gonna say. Good things come to those who wait, and anything that's worth its weight, that has value, is worth waiting for.
Thank you. And I see somebody had a question, okay, about nystagmus, albinism,
Yes.
and eye movements. So that's actually a good question. So with nystagmus, sometimes they call it, that's again, can be a congenital condition. Sometimes they call it dancing eyes because the eyes kind of always move around like this or like that. And you're right, that can occur in albinism. Why? Because the pigment, there's not enough pigment in the retina. And there's a part of the retina called the retinal pigment epithelium. You don't have that, or it's very minimized in albinism, and that helps the eye to see, helps you to focus, and the fovea is underdeveloped. So the eye doesn't get proper stimulation. So it's always kind of moving. Now, people with nystagmus generally, they don't have good vision. They see about 20/200. There's not a whole lot that we can do with that. There's generally one position where the eyes may be, instead of being like straight ahead like this, it may be looking this way or looking that way. That makes it easier for them to see. But that's a congenital condition, and it occurs with nystagmus. If somebody has that, then they should see a strabismus doctor, but there's not a whole lot we can do. And people with albinism do need to wear the dark glasses.
Thank you so much, Dr. Bovelle. If there are no more raised hands, and I don't see any more questions in the chat, Dr. Bovelle, we are going to say thank you to all of the patients that you've demonstrated with technical problems, with all the little things. The truth and power of prevention shine through so brightly in your delivery of eye health, ophthalmology, knowledge, wisdom, insight, and feedback today. You have definitely helped to educate, inspire, and empower our audience. And to have a guest tonight to be able to give testimony to your amazing work, to your committed work, we just say thank you.
Well, it is my pleasure. And when Dr. O asked me, you can't say no to Dr. O.
You can't say no to Dr. O.
So when she knows, I had to say yes. and it's my pleasure. And I just like people to know, please see your ophthalmologist. Know that we work in tandem with your primary care doctor, and that's the way it's done. Nothing in medicine is by itself. We all have to work together. And for people who are on the call in foreign countries, please see your ophthalmologist. If you get a chance to come here to the United States, have someone see you. If you're bringing your parents over, call all of your doctors when you first buy the ticket, like a month ahead of time, so that we can get you in. There are lots of things we can do. And I've had the privilege of seeing some people who thought they were blind and it was just cataracts. We were able to remove it. Some people thought they had cataracts. It was glaucoma. We had to treat them. So there's always hope.
Thank you so much, Dr. Bovelle. And I've done two things. Dr. O has been dropping your contact information in the chat box. So we want to let everyone know, and we want to let you know that here on Medical Mondays, because you've taken precious time, we could not pay you for the expertise that you just shared and the feedback that you've given, an open forum for Q&A. So you are taking patients, right, Dr. Bovelle?
Yes.
I'm coming to get my prescription reading glasses. I want a box like Toy, and I need some that are for me because I've been buying them at Costco, Sam's, the grocery store, online at Amazon. So I'm gonna do the right thing. So thank you. And I've also put the screen and gallery view, and I'm going to ask everyone to unmute your mics for just a moment and give a thank you and round of applause to Dr. Bovelle and Dr. O for another amazing conversation in
Yeah, thank you.
Thank you.
Thank
Thank you so much.
Thank
Thank you.
Thank you. You're the best.
Thank you.
Thank you.
Thank you. And I want to let everybody know. I'm sorry, Dr. O, quickly. I want to let everybody know I can take your camera off.
Don't do that.
I will not. I will not. It's just fun. It's just fun. So thank you so much, Dr. Bovelle. We're going to go to Dr. O now and to hear closing comments. If you don't have any other, you gave us nuggets. See your ophthalmologist. Take care of your eye health. Ophthalmologists should be working in tandem with your primary care physician. And please let me know if there's anything else that we missed, Dr. Bovelle. If not, I'm going to turn the floor over to Dr. O so that she can give her closing comments and remarks, and we can begin to close out tonight's show.
I want to say also to Dr. Bovelle, one time she took care of me and it was for no charge. God bless you so much. It worth thousands that I could pay. I didn't have insurance, but she took care of me, and I want to say, God bless you.
Amen. Amen. That's Dr. Bovelle. Amen.
Amen. I see somebody, Funlola or so, I think that's the name, raise their hand. I don't know.
No, when I contacted them directly, they said that they didn't intend to ask a question.
Yeah, that was okay. Maybe they did again. It's why I, asked again.
Okay.
Thank you so much for an amazing night of education. Thank you. I just want to say, before saying anything else, that every good thing you have to wait for, as we've heard. When you go in to see Dr. Bovelle, she never rushes you. She listens, she examines, she's thorough. It takes time. So the reason why we get results with her is because of the time she takes. But you know what? It's very easy to think about how much time you spend waiting and not think of the time you spend when you're actually with the doctor. So, but thank you for that comment. When you're going to see Dr. Bovelle or you're coming to see me, please bring a reading material because you may have to wait. You're going to, or a game to play on your phone or something, because good care does take good listening to. 80% of diagnosis in medicine is the history. The remaining 20% to hone in on our diagnosis are the testings and stuff that we do. But listening to you is the 80% is very important, and we have to spend time to do that. You have been an amazing audience, and I just want to shout out to our Africans who came in, zoomed in, because we start the program at 12 midnight in Nigeria, for instance. My friend way from high school over 40, almost 50 years ago, and Sister Miriam Oguntimehin is on tonight again. And there are many others, but I see her on the screen right away, and I just want to say, I hope you learned something, and I'm sure you did. Please go see your eye doctor. I know you did the medical missions. When we did our medical missions, we actually have ophthalmologists. We did cataract surgeries. And Dr. Bovelle, a patient I sent to you who was blind, who was brought into my office by two people flanking her on the right and the left. She was blind from cataract. She could not see anymore. But today, she's back working as a medical assistant. And I forgot, I wish I remembered to just, send the link to her to see if she could make it tonight. There are many more testimonies like that. She was able to work. She had to stop working because she was practically blind.
Yes.
Our eyes are very important.
Very, very.
Eye health is important health. And doing our routine health maintenance helps us to be, in stellar condition to achieve our utmost. Next week, we're going to learn about heart health, with an amazing cardiologist. High blood pressure, you will hear about again, and everything to do with the heart. Please come. Bring people. Let's learn. Let's better ourselves. We know that every disease entity, even when it doesn't start with people of color, ends up being a problem of people of color. And that's why this is so important to us, that we come and get educated and take care of our health. Strong health, strong future. So I wish we would say that all the time, when we say strong health, strong future.
Strong future.
Amen.
Health is wealth. Thank you so much for another amazing night. And thank you, Dr. Bovelle.
My pleasure.
Thank you, Dr. O, Dr. Bovelle. And it is so important for us to say these words. Do not leave the Zoom until we've all been unified by our closing song. Music on this show is used to open the show, to inspire you, to calm us, to get us all focused, open, and ready to receive knowledge. I think Dr. Mike told us one time how important music was to our lives. We start the show, we log on at 6:30. So we apologize to all of you early birds who sometimes have to wait. We are practicing, and you see, even with all of the testing and trying out the sharing of screen and everything that we do, we still end up having technical problems that we cannot control. But that is why we have an expert video productions team and an expert video editor who does video editing for phenomenal shows for agencies of federal government, as well as for news, broadcast, and media, and for things like the Grammys. Just an amazing, amazing talent. And he's gonna help us and be able to snip out and edit down and make these shows what we need them to be. Medical Mondays that are spreading word, educating, empowering, and inspiring our communities. A voice for those in need and a voice for those of us who are champions and health VIPs. So thank you, Dr. O, for being the amazing talent around which we're building this Medical Mondays. Thank you, Dr. Bovelle. You've been a part of our team long before Medical Mondays, and we are so happy to welcome you into the Medical Mondays family. Thank you, Dr. Caprice, for our gift and prizes for our Medical Monday audience. Thank you to Hannah and to AJ for winning today's prize. We look forward to spending time with you. And if all hearts and minds are clear, we're going to close tonight's show. Good night, everyone. Thank you so much.